All right, welcome again, everyone. Thank you for joining us for today's Infant Health Equity Supplemental Funding webinar. We're excited to have you back again this month. All right, so we'll just start with our agenda here. I'm going to run through some housekeeping. We'll hear a welcome from Ken Harris from the TA and Support Center team, and then some updates from the grantees. Rhonda Zacox will then go into the action plan overview. Then we're going to have a couple breakout work groups to discuss feedback on the action plan overview and the worksheets and template packets feedback. We'll debrief after both of those and then move into some next steps. So I'll start with the meeting logistics. This session is being recorded and will be saved for future viewing. All participants are muted upon entry, and we ask that you please remain muted during the presentations to limit background noise. You'll have time to come off mute and chat with one another though during those breakout sessions. You are encouraged to participate in the discussion throughout the presentation by typing your questions and comments into the chat box. In terms of connecting to audio conference, if you can hear me now, you're likely connected correctly, but we'll just do a quick review. So you join the Zoom meeting by clicking the Zoom meeting link that was sent to you upon registration. An audio conference box should appear. If it doesn't appear, just click join audio. You can join by either phone call or computer audio. To join by computer audio, just click computer audio, you should be all set. To join by phone call, dial the given number, dial the given meeting ID and press pound, then dial your given participant ID and press pound. In terms of accessing the chat, there's a toolbar to the bottom of your screen. Click the chat button and it will launch the chat box to the right side of your screen. Make sure that you're typing in your comments and questions to everyone so that we can all see them throughout. Now I'm going to go ahead and hand it over to Ken to get us started today.
Thanks so much, Tess, and good afternoon to everyone. I feel like I want to say congratulations to these 21 grantees every time because it's such an important piece of work to be doing at this time in our country, the Infant Health Equity Supplement. So just always gratitude to Melody and then the division and the Maternal Child Health Bureau for really thinking ahead and really working with these Healthy Start communities to put action plans together on infant health equity. So I feel like I always want to say congratulations, but welcome back to the next session. And we have been working hard, as we sure that you have as well. We really wanted to get right in today just to continue and the follow through on the promise we made to you last time, really to get you going on these, developing these action plans. And so we have a lot to do today, but wanted to really start off today by really hearing from you as we've asked you to think about this ahead of time. We really want each of you to take time to kind of share what's been going on. And we're going to help you and just give you 60 seconds to do that. So hopefully you had time to really think about what you could share with this group with regards to what's happened since last we've met, how are things going with your environmental scan, and all the other work you've been doing in between. So anything you want to share in these 60 seconds, you're more than welcome to do that. This is going to be very engaging today. We have some breakout groups going for you. And so we really want you to take an opportunity to really share with one another just to keep each other moving forward. So I will call you out in alphabetical order according to your state. So I'll just run right down the list and we'll time you for 60 seconds. So again, just give us an update and share about your environmental scan and any other activities you've been doing thus far. So let's start off with Northeast Florida Healthy Start Coalition. They're in Jacksonville, Florida. Is anyone on the call that can give us a 60-second update?
Hi, this is Marsha Davis.
Hey, Marsha, how you doing?
Hi, how are you?
Good.
Good. So we are well on our way into the scan. We have hired a consultant in order to provide that and, to work on that, developing that scan. Currently, we have all of the data. She's compiled all of the data and is ready to complete the environmental scan, and she will send it to us to review it by the 30th of this month. We're working on, she has a concept that we're working on the safety of the babies and those social determinants of health, where they live. Wait a minute, I'm trying to pull this up. Technical difficulty.
That's all right. You have a few seconds to work with, Marsha. That's fine.
Okay, a few seconds is good. That's good. But just trying to address those areas, like I said, with housing and with the safe sleep of the child, and also those racial inequities. So we're pulling together focus groups. We're pulling together others from partners with our partners meetings and other agency folks that we can get together to pull that plan together, and also educate as well as get their input on the direction that we're going in with the scan.
Fantastic. Thank you so much, Marsha. Let's move right on to staying in Florida, but Florida Department of Health there in Orlando. Is there someone from Orlando? All right. What about Quincy, Florida? Let's go to the Center for Health Equity. Who's on the call? Give us a 60-second update. All right, we'll keep moving. We can get, if we have time, we can come back later. But how about Chicago? So Access Community Health Network, are you here?
I am here, Ken, and I am ready for you.
Oh,
Good
I
afternoon.
felt, go right ahead.
I already know. I'm in line. I don't want him to miss us. Now I got 50 seconds. Okay, so the Access Community Health Network, in collaboration with the Cook County Healthy Start Projects, we are working in partnership with the Health Alliance for Health Equity. We have our base foundation of what we're going to be looking at. We've looked at some of our benchmarks that we're struggling with. And so we know across the board, we want to focus on reproductive life plans, looking at postpartum, and then looking at our male involvement. And then we're looking at areas in our CANs that we are also focusing on. So literacy, also looking at homelessness, breastfeeding, as well as male involvement. And so we're working, I think Rebecca Williams is on a call, and we're going to do part 2 of that talk about the environmental scan, what will it look like. And we will host our first community forum in December. Rebecca Williams, I don't know if you have anything to say or want to add. If not, that about sums it up for us.
No, thank you so much. I think you summed it all up well.
All right, so well, thank you both for that. All right, let's move right on then to Wichita, Kansas. So County of Sedgwick, does someone can give us a 60-second update there?
Hi, this is Kristen, and I feel like such a cop-out, but I haven't been privy to what other people on my team were doing with this. So I thought I would attend and make sure I can report back, because I don't know where they are right now.
Okay, well, that's fine. We appreciate you sharing that. So we'll get that update later, but thank you very much.
Thanks.
All right, Lafayette, Louisiana. So Family Tree. Is someone on the call from Family Tree?
Yes, this is Macy Doucette with the Family Tree Healthy Start. I'm a CAN coordinator. So we've been doing our environmental scan for a while now. Since Louisiana has some of the worst rates in just about everything, we were very aware that we had a lot of needs that needed to be met. And so we kind of hit the ground running as soon as we found out we were able to have access to this funding. And so we are almost complete as far as our maternal mortality data collecting. That should be finished before the Thanksgiving holiday. We will also be hosting some focus groups for prenatal, postpartum, and interconceptional women. Our program participants will be our base that we will compare to, and then we have community members as a comparison. And then we'll also have a fatherhood group to give us some feedback on their perspective as far as infant health equity, as well as the social determinants of health. And then we're also working to develop an app that we can use not only to build our CAN, but to have kind of a PSA system once we build our action plan, and then be able to connect our participants with some public health information as well.
Wow, that sounds great. There's lots of opportunity for others to learn from what you all are doing since you hit the ground running. So thank you so much. Let's move on to Baltimore. Baltimore Healthy Start.
Sure. Good afternoon, Ken, and good afternoon, everyone. I'm going to represent for our CAN coordinator. Dana is sick today, so I'm sure I'm not going to share everything she would have shared, but I will let you guys know that we started with a fishbone. Housing is our priority area. And it has been our CAN's priority area for a while, but we did a fishbone starting out this process. And as a result of that, Dana has been meeting with relevant people from the housing department, housing developers in our area, individuals on the CAN who had information that they would like to share as well. We have Peter Schaefer on board with us, who's been collecting the demographic and other data from the neighborhoods for us. And we are planning a listening session for tenants and those who support tenants, and also a symposium for landlords in the area, landlords and developers in the area as well.
Great innovation, and a shout out to Peter, because I remember Peter from the original Healthy Stars as Baltimore was there. Fantastic work he does. So good for you all. Thank you so much.
We will not let him go.
Good for you all. That's very smart, very smart. Detroit, Michigan, how about the Institute for Population Health? Is anyone here?
Hello, this is Gwendolyn Daniels, and I will report on our work here in Detroit. I wanted to say that we have a core team of our Healthy Start Project, myself, my program manager, and our CAN manager, and we've been meeting since September to plan our first inaugural CAN meeting and listening session. That happened on October 27th. It was by Zoom. We had 40 participants. And the purpose of that meeting was to do our environmental scan. You need to know and understand that Michigan is really rich in trying to address infant mortality and racial disparities. And so Healthy Start needs to line up with the state initiative, line up with the health department initiative, and understand where the gaps are. So what we did was we met, we introduced our purpose, and we showed Dr. Kamara Jones the CLIF video. And we also talked about data from infant mortality, low birth weight data, and we discussed the purpose of the listening session. So we broke out the 40 people into 5 groups. One group was mothers, the second group was fathers, the third group was maternal child health experts in local experts from Wayne County, the city of Detroit. The fourth group was led by Wayne State University. It was physician students, and they led the group with Michigan Medicaid health plans. And then I had the 5th group was to address social justice, social determinants of health. All right, so we had 5 groups, and each of the groups were asked the same questions. And our questions are, how do we protect pregnant women? How do we protect babies? How do we protect girls before conception? How do we protect women after they've given birth? And how do we protect women before they've had birth? And we asked them to think upstream. We asked them to look at a tree that was flourishing with all the things that you needed, and come up with what you could think would be ideal for us to move the needle forward to reduce infant mortality. And the responses were phenomenal. So we hired a facilitator, and she led the group. And so we have the responses, we wrote them down. And so we're in the process of analyzing that data, putting it in buckets. And so right now we don't know what our priority areas are, but we wanted to hear from our consumers and from our maternal child health experts. And I think we're off to a very good start in order to come up with action plans that are achievable, that are realistic, and that are in line with what is already being done at the state and already with the local level in Detroit.
Well, that was so exciting, Gwen. We gave you more than 60 seconds, but that was great. Thank you so much. Everyone, each of you, the engagement that we're hearing is awesome. I hope everyone take some good notes. Let's move right on to the Intertribal Council of Michigan. There's someone here? All right, that's fine. Let's move right on to Missouri Boot Hill. Darren Sykes, who's here today? All right, we know that Cynthia Dean, we know she's pushing it, so we'll listen for her later. How about moving on to New Jersey? What about Newark Community Health Centers? Who's here today from Newark? That's all right. We have another New Jersey. How about Southern New Jersey Perinatal Cooperative?
Hi, yes, I'm here from Camden, New Jersey. So yeah, we are working on our environmental scan. We already had data collected and information that was shared with the entire CAN to understand where we stand in terms of infant and maternal mortality. And we also hired JSI as our consultant to train our CAN in life course theory, systems of thinking approach, and levels of prevention, because we felt that folks needed to be grounded to be able to understand how to look upstream to find different things going on. Our scan is continuing. We have some key questions. What policies affect the outcomes related to infant mortality? What current laws have that are in place that impact infant mortality? And we have developed a set of key questions for informants from the community, which we're going to ask residents of the county these questions. We also have a special initiative in New Jersey from our governor's office called Nurture New Jersey, where New Jersey wants to be the safest place for a woman to have a person to have a baby. And so we are going to try and tie that into the work we do. We have not identified our key issue. That won't happen until we finish our mapping to understand where the gaps are in our city and in our county. But we've had 3 meetings so far. We had a meeting in September, meeting in October, and we just had one yesterday. So we're moving.
Absolutely, moving very fast. And you hitting that structural systems level is hard with looking at the policy and law. So good for you. All right, that is exciting. Let's move right on to the Bronx. How about Albert Einstein College of Medicine? Anyone here to tell us what's up?
Ken, this is Hal Stromlich, and I'm here to greet everyone from the Bronx and share our challenges. We went through 3 revisions of before we could get it right with the HRSA team. We also went through 3 consultants that we had asked to help us who had various health and family issues that so they had to turn us down after we finally decided to work with the New York Academy of Medicine, which has been our local evaluator since we started this cycle. So we're moving ahead. We put in a request from the health department for new and updated infant equity data for the Bronx. We are meeting tomorrow with our CAN around this initiative and hope to move that quickly forward. And we are putting together a lot of the connections with our state and city-wide influencers, and we're celebrating the election of Vanessa Gibson, a city councilwoman, to become the new Bronx Borough president beginning in January, and we worked with her office to create a new funding stream specifically for the Bronx that's not coming to us, but is coming to the Bronx Health Link, which is one of our community partners, to build the doula services and move forward. And that funding, we hope, will become an annual support for women in the Bronx. So I'll stop with the good news, and thank you for listening to our woes.
That's all right. It sounds like you had challenges, but some good things are working around you. So you're still moving forward. So thank you so much, Hal. Let's go into the county of Onondaga, Syracuse. What's happening in Syracuse? Anyone here? All right, let's move to Five Rivers Health Centers, Dayton, Ohio.
Hi, I'm from Gina McFarland L, and we're excited about being a part of this project. So we've hired our consultant, Dr. Meredith Smith and Lucinda from Palmieri Productions. And because we're the only project within Ohio, our goal was to create more Queens villages that we've created, or listening circles within Ohio. And so what we've done from the environmental scans standpoint is that there are 25 different organizations that have been working on infant mortality. And we thought it was a great idea to just put all of that information together in one document so we could share with our Queens Villages. And so we've set up the Queens Villages dates that will be taking place in December and in January. And right now we have reached out to all of the 25 different organizations and asked what are their priorities so that we could then talk to the women in the major cities within Ohio that have the highest infant mortality rate. It looks like we'll have about 8 different listening circles. So we call them Queens Villages because the women are going to speak from their Queens perspective. And we're excited that based upon all of that information, the women will come up with what those priorities will be. But we're not just doing it for Dayton, Ohio, we're doing it for the entire state of Ohio. So we're excited about that.
Great, and we can feel that excitement. Thank you so much. We're gonna go right to the Foundation for Delaware County, Pennsylvania. You have anyone from the foundation today?
I'm showing up as Joanne Craig for some
Hey,
reason,
Joanne.
but I'm not
Okay.
Joanne Craig. I'm
Oh.
my team coordinator. There's Joanne too. That's
Okay.
strange. I don't know how that happened. And I'm excited because our whole internal planning team is here today. So Onaje, Akeisha, Denise, Joanne. We also have our evaluators, Gabrielle and Araba, on the call. I'm just going to quickly go over our progress so far. We've developed a specific planning team out of our CAN. And so we have 20 individual partners who are working with us. It includes a group of current or former program participants, community members. We have a new county health department. So launching in January 2022, that's a big part of our planning process, is alignment with the incoming county health department, birth workers, policy expertise around healthcare, housing, and childcare. Our environmental scan plan has been designed, and actually on Friday, our committee are going to break it apart and take responsibility for segments of it. So we'll be working in 2s and 3s over the course of the next month. We're really looking at housing, transportation, education, physical environment, social environment, access to services, political and civic engagement, racism and discrimination, food security, employment, and income. And so our planning committee will actually be working through our environmental scan together. We're also working, Diane and I were part of the Cultivating Leaders Initiative. So we're also working with JSI, and we're also doing training on life course theory and systems thinking with our committee. We have our first training coming on Friday. We should just cross the bridge and do it together because we're right across, we can practically wave.
That makes sense. Mm-hmm.
And then we're also planning to do community conversations throughout the month of December, facilitated by our planning committee members, and really engaging families with young children to talk about their kind of prioritization of what they would like to see and what their barriers and challenges have been. So we're excited, super excited.
Awesome. Again, we feel that excitement as well. So we have a couple more and just a few more moments here. So Healthy Start in Pittsburgh. Anyone from Healthy Start Pittsburgh? All right. What about University of Houston System? They're in Houston, Texas. All right, let's stay in Texas and go to BCFS, Health and Human Services in San Antonio. All right, what about Urban Strategies in Virginia? Anyone from Urban Strategies today? All right, well, that's great. These have been some exciting, okay, thank you, Diane, for letting us know. Angela from Newark, her mic wasn't working, but she's here, so thank you. If you want to put anything in the chat, Angela, feel free to do that. These have been great updates, and hopefully folks have been able to take some nuggets as you've heard your colleagues share. We heard JSI, the lifespan came up a couple of times as well, so that's a very good tool So it's good that folks have reached out as well. And thank you, Gracie and Roberts Harris as well from Staten Island is here. So again, if you have any update you want to throw in the chat to share with the colleagues, feel free to do that. We're going to get ready to transition and get in the exciting, the tools that you've seen, had a chance to look at, we're going to go through today. And we're really excited to be working with Dr. Rhonda Zaycox. And I just wanted to take a couple of minutes to really introduce her. Folks are, you know, in the habit of just hearing from subject matter experts that are not always connected to the work. And so I really wanted to take time to introduce her today because of the importance of this infant health equity initiative and what the division in the Bureau is up to with regards to looking at addressing infant health equity as we move forward in the next few years, especially in context of Healthy People 2030. But Rhonda has been around community coalition work like since the 90s. And those of you that are old enough to remember, we had initiatives like the Fighting Back initiative from Robert Wood Johnson and other kind of coalition building initiatives out there. And so Rhonda's been doing this work for several decades, but she is a colleague who's really committed to working in partnership with communities. And the reason I wanted to emphasize that, because she's really agreed to work with us here at the TA Center as a partner. And I started working with her over a decade ago. And so it was her passion for purpose-driven work that really connected us, and really her brilliance as a systems thinker that really bonded us in the work that we did together. And for me, it's really her authenticity that continues to allow us to work together. And I'm glad that she's agreed to come and support us as we support you in developing these action plans. And so the TN Support Center has connected with her to work with us as we work with you all in partnership to really create this transformational tool, this action plan that you all are working on to really provide your Healthy Start communities with an awesome opportunity to inspire that transformational change that each of you have talked about today. And so we're really excited that she's here and just share some of the work we've been doing and the tools and their development, and really to engage you in finalizing these tools. So again, thank you to all the 21 grantees for really stepping up in the maternal and child health space as representatives of the 101 Healthy Start grantees and leading the way and really developing these transformational action plans. And so we are committed to your success. And one of the ways we show that is by getting the right people to come. So we think we've done that. And so with that, Rhonda, I would like to introduce you and have you take it away, and let's get into these tools that you worked so hard on.
Well, thank you, Ken. I appreciate that introduction. Hi, everyone. I'm Rhonda Zaycox, and I use she and her pronouns. And I'm just really so grateful to be here with all of you. I'm very grateful that Ken had reached out to me to be a partner on this inspiring initiative, as well as grateful to get to know the staff at the Technical Assistance Center. And also just really grateful that I'm going to get to know and connect with many of you who are working so tenaciously in your communities to really address infant health inequities. You know, as Ken mentioned, I became familiar with Healthy Start about a decade ago when he was the director of the New Haven Healthy Start program. And I had the privilege of working with him, his amazing staff, and the community, the CAN, back then had a different name, but the group of folks that were coming together in New Haven. And really we're trying to figure out how can we know if our CAN is really effective and doing well. So we collaborated on developing a tool and framework to do that. And I just became really enamored with the work that the Healthy Start programs are doing across the country. So happy to be back here again. Just a quick snapshot about my group, Insight for Action. I founded Insight in Action. We're a boutique consulting group in Portland, Oregon, where we collaborate with purpose-driven organizations to help strengthen their social impact by serving as a learning partner. And learning partner, what does that mean? But we take it really seriously. We believe we all have wisdom to learn and share from each other. And so we come as a collaborator when we're working with nonprofits and foundations to really help think through strategy how we're assessing traction, and how can we adapt in the complexity of the work that we're doing, especially around social determinants of health and structural racism. So that's an area that I spend a lot of time in trying to bring, as Ken and all of you have mentioned, I think many of you have mentioned, really a systems thinking perspective, because that's what we need when we're trying to address those root causes and social determinants. And I'll just want to acknowledge, this is the first time I've gotten to know you, I've been on my own journey. I'm a woman, a white woman of privilege, and I've been on my journey really trying to acknowledge and understand the white supremacy of the culture that I've been indoctrinated to. And I'm always trying to unlearn many of those things and to learn new ways of thinking about how change happens. And so I invite you to help me learn as we go through this process. So that's a little bit about me. And now I would like to talk and share a little bit about this action planning framework that we are hopefully going to be co-developing together. You want to move the slide, Tess? Thank you. But before we do that, I'm hoping I might have a little bit of group participation here. And I'm wondering if there's 4 people who could raise their hand really quickly and just agree to read a sentence on this very powerful narrative that's on our screen. And I'm going to just first see if people, just 3 or 4 people will raise their hand really quickly and say that they'll read a sentence, and I'll just call you out. Come on, don't be shy. Let's hear your beautiful voices. Ken, I know I can put you down. I'm going to put you down. Come on. 2 more people, just say I'll do it, raise your hand or say yes.
I'll do it.
All right, who's that?
Marsha Davis.
Marsha, and I see Tamika. Great, 1 more person. Joanne, thank you. Great, okay. Ken, I'm gonna ask each of you to read a sentence on here. Ken, will you read the first sentence?
Okay. Our charge: by health inequities, we mean gaps that are unjust, avoidable, unnecessary, and unfair. They are neither natural nor inevitable.
Great, thank you. Marsha, would you be read the second one?
Whether they are produced and sustained by deeply entrenched social systems that intentionally and unintentionally prevent people from reaching their full potential.
Thank you for sharing your beautiful voice. Tamika, would you be willing to read the next one?
Yes, inequities cannot be understood or adequately addressed if we focus only on individuals, their behavior, or their biology.
Thank you for sharing your beautiful voice. Joanne, would you read the last one?
We have the opportunity and the obligation to do better and to achieve more equitable outcomes.
Great. Thank you for taking a moment to read and listen to the statement that I think, when I think about Healthy Start, and when I think specifically about this Infant Health Equity Initiative, this really spoke to me. And I see this as a collective charge.
Rhonda, you went on mute.
Sorry, I am so sorry. Yeah, I'm so sorry. Thank you. I just want to say thank you for everyone and see that this is the charge that Healthy Starts and this Infant Health Equity Initiative, I believe, is focusing on. Can we have the next slide, please? Great. So, of course, many of us have done action planning. There are many, many different tools out there to think about strategy and action planning. But I think why Ken was interested in co-developing perhaps a toolkit that could help us in this specific initiative is that we all want to improve infant health equity. And we all know that these structural and social determinants of health are complex. And yet it's hard to determine which structural and social determinants of health and upstream solutions to shift conditions that are holding infant inequities in place. It's tough, it's difficult, it's challenging. None of us have the answer. So we are trying to bring our collective wisdom together to develop somewhat of a toolkit that can help us have a blueprint to navigate the complexity of shifting social determinants of health to increase our chances of improving infant health equity. Next slide, please. Here were some of the principles that the Technical Assistance Center and I shared as we wanted to put together an action planning toolkit. We don't want to recreate the wheel. We want to borrow the best ideas from others, including many of you who have done really good work around action planning, specifically thinking about social determinants of health. We also wanted to co-create it with you all. Of course, we took some initial effort to get something out there, to get the wheels turning, but we're hoping today and over the next couple of weeks that we're going to get some really good feedback from you on how we can make this better and make it a useful tool for all of us. We also want to keep it simple. You know, tools can get really complex, and we want to keep it simple so it's actionable. And of course, we really want to focus on shifting the structural conditions through upstream solutions as we're doing the action planning. And we want to make whatever we do accessible for community engagement, because listening to you, many of you are already engaging those who are most affected by the issue and wanting to hear community voices, so making that accessible for them. Next slide, please. There are many frameworks, and many of you may have your preferred framework when we think about social determinants of health. Ken and I really like this one by the Bay Area BARI organization. And I think what I wanted just to pull out from this is we all know the Infant Health Equity Initiative here is really focusing on that circle, really focusing on the social and institutional inequities and the living conditions that, again, hold these patterns of structural inequity in place. And we really want to figure out how we can shift those conditions so that we can create better opportunities for infant health equity. Is someone gonna had a question, comment? Go ahead, if you could please move the next slide. So our process for designing the action planning toolkit, again, we scanned best ideas crafted by others. What we're sharing today is assembled a draft toolkit. Again, we're soliciting your wisdom today. We're really hoping in our breakout sessions and debrief, and then what we ask you afterwards to really share your thoughts of what we can include to make this a better tool for all of us. And then of course, after we get your feedback, we will refine it into a more useful toolkit that becomes the community action planning toolkit. Next slide, please. And I believe that you received 3 PDFs prior to this call. Some of you may have had an opportunity to look at them, others not. So I just want to give an overview of what we mean by the action planning toolkit. There is a 3-page overview that kind of covers some of the things I just talked about. There is also a worksheet packet. Right now, there's 5 worksheets that your planning teams may or may not find useful to help you think through some of the action planning questions. And then there's a template packet that has 3 templates for which you could actually use to create some of the documents to help communicate and share the idea. There's also a tool packet that's in process. You did not receive it, but literally it's a listing of kind of the best ideas around how do you really co-create with community, engage community throughout the process, or how as a group do you use group decision-making to make decisions as you're doing action planning. And that will be coming out soon. And of course, we'll hopefully get your feedback on other ideas for that. Next slide, please. All right, so in the action plan, there's kind of 8 steps that we are offering. And again, many of these steps are things that you're probably already doing or engaging in. And that's on the left-hand side. And of course, the idea is the action planning process will then help create a navigational blueprint for change to really target those upstream strategies. So to shift those social determinants of health that are holding inequities in place, ultimately, and to improve infant health equity. Next slide, please. So the action planning roadmap has these 8 steps, and I'm just going to quickly highlight these 8 steps for those of you who did not have an opportunity to look at the packet. But the first step is really get the team ready. Many of you have already established planning teams. and are moving forward on it. And it's always really helpful to really clarify who is our planning team and what processes will guide action planning. In that worksheet, there's 16 questions, and some of these questions you may have already addressed, some of them may be new, but it's really to get you all together to be most effective as you move through the action planning process. And there are some tools that potentially could help you think through some of these things when that toolkit is ready. The second step, of course, is begin with the end of the mind, and that is, what is our Healthy Start vision for whom and where? This is really all information you probably already have, but it asks you 4 questions to really get clear about what is the goal, the vision, and for whom that you are targeting. Of course, many of you are conducting an environmental scan, and the toolkit doesn't really provide any more information on the environmental scan. I believe many of you have hired consultants. Ken already did a webinar on that. So you're gonna, moving forward on that, hopefully get some rich information about what social determinants of health impact infant health inequities in our service area. And then 4 is, the step 4 is really then to say, okay, what is the most important social determinant of health for us to address now? The power of one. And we can have some discussions around this in the breakout rooms about that, but really helping you to grapple with 3 questions around getting to prioritizing, because we all can't do everything. And then the 5th step is visualize success. Really being clear, what is our desired future state for our priority social determinant of health? It's the status quo, and it's visualizing what would housing look like if we had more affordable housing for our families in our community. What would that look like? What would that feel like? Then 6 is setting the strategic direction, and that is really clarifying what are the upstream strategies you will implement to address the priority social determinant of health. And there's a worksheet with really 2 questions and some tools to help you do that, a strategy map template specifically. And then number 7 is develop the work plan. And that's your classic kind of, what are the actions that we need to take to execute the strategies in the first 6 months. So this isn't for the whole 3 to 5 or 10 years. It's really the first 6 months to get us started. And there's a matrix template for that. And last, of course, is to build the action plan. And that is really how will we communicate and hold ourselves accountable for carrying out the plan. And there's a template there that gives all the information in a 2-pager. Because a 2-page is what we need to be able to communicate and understand what we're about to do and how we're going to do it. So I know I just threw a lot at you. I'm going to pause and invite Ken or anyone from the Technical Assistance Center to add any other background that you think would be helpful, or ask and or invite any questions.
Well, Rhonda, for me, I think you covered it all. I think a couple of things I would just lift up even and more, just for folks to understand, is again, the process we went through to get here is again, doing some of that initial work. I've been looking at so many different action plans that are out there, looking at kind of the best of the best, integrating that here. And again, pieces of the toolkits you talked about, those tools, we'll have those resources laid out for you really easily with links, et cetera. So again, it's not about reinventing the wheel. So we've tried to make sure that we accounted for that throughout the entire document. So just to lift that up a little bit more. But other than that, Rhonda, it's great.
So we are going to jump into breakout sessions, but if there's any burning questions that folks have right now, please feel free to ask either in chat or in the mic.
Hi, this is Gabrielle Grode with the Foundation for Delaware County. And you mentioned the power of one single social determinant of health. So is that the expectation that we're going to come to consensus at some point in this process on the one root cause issue that we're going to focus on in the first 6 months, and all the other things will go to like the parking lot?
I can respond to that, but then I will obviously refer to Ken for that. Gabrielle, that's the proposal for you to consider. In this action planning process, we are encouraging you to think about one most important social determinant of health to tackle right now. I love how you said, put other things on the parking lot. Of course, you're going to make choices whether you want to do that or not, but we're encouraging you to think about addressing the one social determinant of health now, at least for the first 6 months, because we really believe that to get traction on something as big as a social determinant that you want to shift takes a lot of concentrated effort and resources and partnership. And we believe in the power of one to get you moving. Focusing that on for the first 6 months would be one way to consider doing that. But I'll pause and let Ken also respond to his perspective on that.
Yeah, and from our conversations, Ron, I think you represent the response that I would have. And again, it's your choice. And again, we acknowledging that you're working with the community, and it's really that community will decide. But I think as we go through this and talk about why we're kind of encouraging the power of one, I think people have a better understanding of what's meant by that, because it's not to ignore that there are others. We talked before the interrelation of them. All of that's part of the conversation. But again, as Rhonda said, how do we really get traction and movement? Because as you're working with a group, you certainly want them to see movement towards. And so that's, again, some of the reasoning why we're asking for that consideration. But I think we'll get more into it in conversation. And this feedback is helpful to hear too. So that's why I want to put it out here this way.
Okay, if there's not any larger questions, and hopefully, Gabrielle, these are the exact things that we will continue to have conversations about in the breakout rooms. But we could move forward.
Thanks,
Yeah,
Rhonda.
and Rhonda, I was just going to acknowledge that staff have put the documents in the chat. So folks that didn't get a chance to read them or see them in your email, go ahead and click on those so you'll have them. Excuse me.
Thanks, Ken. During these breakouts, we're also going to ask that you all utilize the Jamboard to post your comments that are coming up during these breakout sessions. So I've just put the Jamboard link in the chat to use Jamboard. As you can see, the page is all set up already. You just go over to the left side, click the sticky note. You can type your comment in here, make it whatever color you want, and then pop it on the main page. So if you have any additional questions, feel free to let us know during the breakouts, but we will now move into breakout rooms.
Well, Rhonda, we had a good time. I hope you had a good time in your group. All right, so we're going to take a few minutes to debrief and just open it up again. We did 2 groups, and so if folks want to just come off mute and share a few things, we'll take a few minutes to do that before we go into another breakout to discuss the other pieces. But overview document, any thoughts you have from your group you would like to share with everyone? Yep, go right ahead.
I think the idea of involving the CAN, so it's just not the Healthy Start program trying to do the work or do the heavy lift on their own, but involving people from different sectors to do the work and get invested in the work.
Thank you, LaShawn.
Ken, I actually like this action plan and roadmap. It helps take the collective impact framework to like the next level because we have been doing the work in many of our projects. So this gives me a different framework, and I'm working with our partner offline. So we got to re-strategize. We're trying to do too much. Now we got to wheel it back a little bit and go through the steps, but it's okay.
Right. That's all right. Thank you, Tamika. And Najee put a resource in the chat as well if you want to check that out. Anyone else has any thoughts? And I think in our opening today, we heard a lot of folks engaging different sectors, different folks. So that leadership Tamika just mentioned, we hear that that's happening as you guys gave your update. So that's important for that ownership. And we talked about that in our group too, the community ownership happens there. It's not just for the Healthy Start program, but it's for your community. So it's good to hear those consistent themes. Anyone else? Any other thoughts you want to share about the overview? Awesome. And when we ask you at the end for follow-up, if you have good things to say or compliments, and it'd be great to hear that as well. So if we've hit the mark, let us know. But I think enhancing, strengthening, and building off of or building from. As Tamika mentioned, the last round of Healthy Start was definitely that collective impact framework. So we certainly thought about that. So again, it's enhancing and strengthening and building off of what's been out there and what Healthy Start's been doing for a long time to ensure that you're really able to move this action plan forward next spring. Okay, Rhonda, do you have any thoughts from your group before we break out again? You want to share?
Oh, well, I thought, as always, got some really great insight and wisdom from the group members. A couple of things stood out in my mind is really this relationship between, you know, figuring out who needs to be on your planning team as you're looking at the environmental scan. It's, you know, because once you identify where you have gaps, you might want to tap different people to come on the planning team. So I thought knowing, you know, the reciprocalness of that was really important. Another key point is around leadership development. If we are inviting and wanting those people most affected by the issue or community members to come to the decision-making table on the planning team, there needs to be some leadership development so folks can participate as equal partners. That was well, I think, identified and needs to be highlighted. And also really when we have a planning team, people have different understandings of upstream and social determinants of health. And so how do you really prepare the planning team to understand what that looks like? And we talked about how a couple of the Healthy Start programs have really contracted out with GSI to do that training and how important it is to lift that up. And I think also another point that was made is, you know, we're all doing a lot of work and a lot of it is downstream and we're going to keep on doing that downstream work. And so we just need to acknowledge that and we're pushing upstream now. So it's not like we're going to stop the downstream work, but we are going to continue it, but we're going to put more effort on the upstream. And I think Katie's going to look for a slide or a picture that can help us with that. And then I think another point that was raised is, you know, the actual action plan, it's a living document. Things are going to constantly be changing. And so we really want to make sure that action plan template is amenable to being updated in real time as conditions are changed. So those were just some of the kernels that really stuck with me that I want to go back and figure out how to ensure that we're really highlighting and uplifting those into the action planning framework and toolkit. So thank you for those great ideas.
Mm-hmm. Yeah, Ron, it sounded a couple of things you mentioned were part of our conversation I know went into, for example, tracking the engagement. We talked about communication. So when people do come along at different points, how are you able to communicate where you are and what's going on, to being able to do that? So I think that was included as well. So that's good to hear those things. Naja, I see your hand, sir.
Yeah, we didn't talk about it, but I'm just kind of remembering that there's an upsurge of counties and towns really saying that racism is a community crisis. And just recently, like about a week or two ago in New York City, the health department declared it. So I think we have an opportunity to draw the link between what people are saying is a problem. And I think we can like walk right into that space, or at least join those two things together to show, okay, well, now that you have, you know, declared racism a public health crisis, what steps can we do to meet you halfway and create a bridge together to solving some of those problems?
Yeah, thank you for that, Naja. Great. All right, so we're going to move to the next breakout. Katie found the picture. So take a picture on your phone, like screenshot, and send that to us, and we'll post it if you want. So, because we couldn't see it when you held it up. I did see you there, but yeah, if you wanted to share it.
Well, it was from Ken's previous presentation. It was it's something that had really resonated for me from it was one of your slides. Okay. From an original presentation around kind of the social ecological model. So we had this conversation about like kind of conceiving of the continuity of the work. And so I had shared that a lot of our work from our original community action plan, which was 2017 to 2022, had been really relational and had been organizational. Like that's where the action had happened. But you had shared a slide that really looked at, it was like the rings of the social ecological, but with the arrow pushing outwards into the community and into the kind of legislative policy advocacy realms and spaces. And remembering that the relational and the organizational stuff doesn't stop, right? This is about scaling the work out. It's not like those two rings are done with and they're out. It really is about continuing to do the work at that interpersonal at that organizational level, and then scaling it to work at the community level and and that was really helpful for me.
Awesome. Yeah. And that was adapted from that community pathways, one of the references in the FOA. So yeah, good stuff. Thank you so much for that, Katie. All right. Tess, to you, right?
Thanks, Ken. So we are going to use that same Jamboard link as last time. You can just flip along to the next 2 slides. Up top, it'll just have a little arrow, and we will collect your input on worksheet and template packets. So we are going to direct you all back into your groups, and you'll have about 20 minutes. Thanks.
Rhonda, I'll let you kick off this debrief. We had a good time again. I'm sure you did too, but I'll let you kick it off.
Great. Well, I would love for people to share what some of the dialogue was in their breakout sessions, ideas that you came up with for us to consider including into the tools of the frameworks, modifications of what we may have showed you. In our group, we focused on the strategy map, and on worksheet number 3, really the prioritization of the social determinant of health. Those were the 2 areas that we focused on. So I want to open it up. What bubbled up?
This is Tamika. I think what in this session really helped to looking at some of the templates to give me a visual framework of how we should proceed, or thoughts that we had considered in our environmental scan, but then also the verbiage needed, for those folks who are at the table from the community that may or may not understand Healthy Start, of like what our true purpose is moving forward, and looking at those upstream system outcomes that we're seeking to achieve, so that we can have that continued buy-in. So this is just helpful to think through.
Yeah. Anyone else from our team? Yeah. And Rhonda, we paused a little bit on the prioritization as well, of the social determinants, just to elaborate on that a bit more. And then I also took the opportunity to talk a bit more about the force field analysis, that FSG, because I thought that was a good opportunity to lift up for them now. So, but everyone is committed to like digging a little deeper into and providing feedback by the next time. So it was some good conversation.
Great, and I'll share a little insights that I really learned about prioritization, and I hope my breakout fellow members will jump in as well. When we look at that inverted pyramid, that the environmental scan is going to generate a lot of potential social determinants of health. They're going to be interrelated and connected. So really, how do you go from so many to prioritizing? Whether you prioritize one or prioritize a couple, you have to get to that some of that process. And so in the worksheet right now, it's offered more of kind of that fishbone and 5 whys, as well as really looking at the potential of impact if we try to influence, and the feasibility of us doing it to get to that priority. There was actually 2 other great suggestions that folks made about ways to prioritize. And one was really, it's really, what is the community willing to focus on and want to address? That could be a real important criteria for narrowing. And a second one is, what is going on in the community where there's already a lot of energy and effort that's going around that social determinant of health that we can then catalyze. So I thought those were 2 great additional considerations to add into that. And a third thing related to it was, thinking what is the community willing to move and address, and where is the community already energized? A lot of it always comes down to power. So it might be helpful to have like a power analysis tool. There's so many out there, and I probably will tap some of my fellow breakout participants who talked about that. But, really being able to be clear about who's holding power, especially when we went to the strategy map and we were looking at who holds power over the shifting the social determinants of health, and who are those power brokers, that might be another way of really getting at power.
Yeah, and we can spend time talking about it. That also makes me think about, you try to identify who has the power, but then you also want to really remind the community of their power. So there's lots of great groups out there working with communities of color that talk about the power that we have, because, you know, some people are tired of lifting their voice and you're not hearing it. And so they have created, instead of begging to be at your table, to create your own table. So there's lots of, I think, some other stuff that we can look at related to that about the power. Healthy Start communities also have done the Undoing Racism with the People's Institute, and that power analysis that they have is very, very popular. So yeah, so we can think about some more tools there, but that's a very, very good one because that incorporates the history. And I know of Healthy Start programs, over 70% of Healthy Start programs are in historically redlined communities. And so again, having those that kind of collection of how power came into be helps dismantle it or deconstruct it as well. So, but great suggestions. I'm glad to hear that came up too, but we certainly can, there's some good tools to lift up and add to that resource list as well.
I'll just open it again for anyone who was in the breakout room with me to add on what I said or other ideas that bubbled up to share with a larger group. One other thing that our group talked about when I pulled up the strategy map was really being clear that the strategy map, which is template, it's in the template packet under kind of step 6, set strategic direction, that is a tool that would be used towards the end of the action planning process. That's the tool that you might not look at until February because it's built upon all the previous steps of doing the environmental scan and prioritizing. And so it's just acknowledging that some of those tools, of course, are better off later in the process than early in the process. And so it's just acknowledging that.
Yeah, and Ron, it also reminds me of just encouraging folks to really look back at their needs assessment too, and the things that you already know from your community, the voice of the community you already have as a Healthy Start program. How do you lift that up and make sure that's part of this? Because that needs assessment, the environmental scan, all of that's important to go into developing this action plan. But again, building on what you've known, because we know that people are sick and tired of being sick and tired. So some of those issues you already know what they're willing to do and not willing to do. So as we mentioned before, you want to be careful not to reinvent the wheel or lose time doing something you may already know. So certainly build off of what you already know. And I think that's one of the reasons why U21 were selected from that competitive process, because you're ahead in a good place to kind of really have it enhance and strengthen and move you quicker. So just wanted to highlight that as well for you all.
Okay, so I don't know if I'm not hearing other people reporting out. Ken or Tess, I don't know when we're going to just remind folks that they're going to have the opportunity to look at the templates and provide more detailed feedback, that process. And maybe that's a next step.
Yeah, absolutely. So we'll wrap up the debrief here and then we'll hand it off to Tess to kind of wrap us up. But thank you all very much. Both breakout groups are great, great feedback so far, and you'll have opportunity and Tess will talk about that. And we look forward to that feedback. Again, we're modeling what we're doing as a community action network and being inclusive and engaging. And again, co-creating is really what this is about. And so we look forward to getting a stronger document based on the feedback we get from you. So thank you. Tess, we'll kick it back to you.
Thank you, Ken. All right, so thank you for queuing me up for next steps. As Rhonda and Ken mentioned, we will be sending out links to these Google Docs of these templates that you guys have reviewed today, just to give you a little more time to look in, maybe dig in a little deeper and provide any additional feedback that may come to mind after this meeting or as you look in further. So we're asking that you please leave any additional comments that you have by Monday, November 22nd, so this upcoming Monday at 12 p.m. Eastern Time. We will be sending out links to those Google Docs in a follow-up email after this meeting, and you'll see yellow boxes throughout that ask you to put your feedback there. So feel free to just comment anything additional that you have in those documents.
Tess, can I just make one real request, which I talked about my breakout room. For those of you who make the time between 12 midnight and 4 a.m. to do this, we are so appreciative of you angels. And, please put other tools or other ideas, links, because again, we're trying to build a community of tools and processes that other peoples have used. We just offered a couple of our, best ideas, but we know that you all have more, and you've already shared many today. Keep that coming, because that's really going to help us build out a framework and tools that are helpful for everyone.
Awesome. Thank you, Rhonda. All right. So, and with that feedback, we're going to be creating version 3.0 of the tools that you saw today, kind of integrating the feedback we received here, as well as additional comments that any of you may have in those Google Docs. And we'll have those prepared before our next Infant Health Equity meeting, which will be a drop-in on Wednesday, December 1st from 2 to 3. So we'll kind of be reviewing 3.0 and looking forward from there. Our next official webinar will be on Wednesday, December 8th from 2 to 4, and we will follow up with more information on the content of that meeting. Those calendar invitations have been sent out to the group. If you don't have them, please feel free to email us at healthystart@nhq.org. We'll get those right over to you. Now we are going to launch a brief satisfaction survey while we close up to get your feedback on today's webinar. There we go. So just if you could complete these couple questions just as we're finishing up, would be greatly helpful for us. A reminder that we do have a collab page set up for the Infant Health Equity Supplement recipients. So this is a space where we're going to post resources, things that we've shared in these meetings. You can also connect with your fellow grantees who have received this supplement through this collab group. So you could consider introducing yourself and the work that you're doing. Also, as Rhonda mentioned, feel free to share any tools here as well through the collab group. So that has been set up. So if you need any help accessing that, either the collab group or your collab profile in general, feel free to email us at healthystart@nhq.org and we can get you set up there. And in closing, thank you so much. This has been a great, really useful time today. Thank you so much for providing all of your feedback. We look forward to any additional feedback you may have in the Google Docs. And yeah, thank you again for coming, and I hope everyone has a great rest of their day.
Thanks.
Take care, everyone.
Happy Thanksgiving if I don't hear from you guys.
All right.
For those who celebrate.
Thank you, Tate.
Thank you. Same to you. Yeah, have a good evening.
All right.
Thank you. This was a great session. Thanks.
Thanks, Diane.
Bye.